Hello, I'm Ibtisam Abdul Qadir. I'm an assistant professor at King Saud University, and this work was done with collaborators from different universities. Today, I'll be talking about our paper, Understanding the Therapeutic Coaching Needs of Mother of Children with Cerebral Palsy. What is cerebral palsy? It's a neurodevelopmental movement disorder that appears in early childhood, affecting the muscular control, posture, and balance. Since most developmental milestones in early childhood are associated with physical and communicative functioning, such as walking, speech production, children with cerebral palsy can often be considerably delayed in these areas by the time they receive a formal diagnosis. One of the most common delays encountered in cerebral palsy is related to speech and language development, and home-based speech and language therapy programs provided for parents of the preschool children with cerebral palsy. When considering early speech and language therapy intervention for children with cerebral palsy, it's worth noting the impact their associated movement difficulties can have on their overall communication development. The muscles required to produce speech may be weak, causing significant impairments to speech quality and clarity. Early speech and language therapy for preschool children focuses on working with the family to develop the communication skills essential to the child through playing, reading, or talking. This type of therapy is generally indirectly delivered by trained parents or other caregivers instead of the therapist to the child directly, and is found to be effective in enhancing children's communication skills before starting school. It has been noted that the parent engaging in home-based therapy program have significant challenges and requires additional support and guidance. And these home programs are challenged by infrequent therapy visits, and that the amount of the therapy that the family receives varies greatly. Also, that the parent often felt overwhelmed and struggled to deliver the programs at home. Therefore, our study provides a contextual understanding of the support and empowerment needs of mothers of children with cerebral palsy. Much of the prior work demonstrates current mobile technology to support children's development with or without special needs. These are a few examples of technology which are mostly developed to directly target the children using assistive technology or to monitor and track children's development and support the diagnosis and treatment of communication disorders. We noted that supporting parents of preschool children with complex needs in delivering home-based therapy programs is not yet fully explored. Our two-phase study was configured to fill this gap in knowledge. To conduct this research, we managed to recruit 7 mothers of children with cerebral palsy and 4 speech and language therapists. All mothers were experienced in receiving home-based therapy programs, while all therapists were domain experts working with preschool children with special needs with up to 12 years of experience. The first phase of this study involved a context exploration with the mother and the therapist. Mothers were visited in their homes for 90 minutes and took part in an open-ended semi-structured interview to understand their daily caregiving routine and activities, their concerns about parent-delivered therapy, as well as the kind of support and training received. Also, the therapist took part in an open-ended semi-structured interview, which held in the university campus and lasted about 60 minutes. The therapist interview focused on understanding their current working routine and practices, the issue they experience with the home program, and the type of support and communication strategy they used with the parent. The first phase results revealed 4 main areas of challenges, which we will discuss. The first finding related to the motherhood and the challenges of disability. Initially, the mothers emphasized the fundamental change in their lives resulting from having a child with special needs. The mother responsibilities included looking after the child's needs, tracking development, learning from different therapists, and ensuring that other carers implement what the mother have learned. Many challenges were identified, such as commitment to many therapy visits from different specialized therapists and having less time for other family members or personal responsibilities. The second finding related to the parent experiences of delivering therapy. The mother also remarked on the challenges of working with a large team of professionals and therapy activities. Some of the challenges faced by the mothers include that the visit sessions are organized based on the child progress and needs, so there is no fixed visit schedule and it's infrequent. The mother also mentioned the challenge of their forgetfulness of practice and their frustration while applying practices alone. On the other hand, the therapists were challenged by their struggle to complete everything with a limited visit time and the lack of other communication channels, with the most information being communicated to the mother verbally. The third finding related to social support and communication practices. Several within family sharing practices and motivation for sharing were apparent. This include sharing content to teach other family members on therapy practices and sharing the child achievements and medical updates. The fourth finding related to digital technology used. Most of the mothers confirmed their use of WhatsApp, Instagram, and Facebook accounts to share information with family and close friends. On the other hand, communication channels used to share with the professional between their visits were limited to phone calls and emails. However, the therapist confirmed the importance of having an open communication line with the mother for ongoing support. Based on the identified practices surrounding the video capture and sharing parents were currently engaged in, we decided to focus the design phase of this work in exploring how these practices might be leveraged in future to support parents in delivering therapy at home. Thus, the second phase started with a pre-workshop video capture by the parent, followed by a series of 3 workshops, where the first 2 workshops involved parents alone and the final one with the therapists. In the video capture stage, we asked the parent to engage in capturing a series of short videos of their play session with their children and share it with us through WhatsApp. This is done to mimic the experience of remote video coaching experience and provide insight for the design workshops. The second phase finding helped develop a shared understanding of implications for designing asynchronous video-based tool that would allow therapists to coach parents. The first finding related to perspective of coaching in speech and language therapy. Most of the mother and therapists reported that mothers were looking for confirmation on their understanding of therapy strategy and guidance, as well as encouragement and assurance around the correctness of their practices. The second finding related to practicality of capturing and sharing videos. During the trial, the mother shared several recordings. Mother created these recordings during feeding, exercising, and playtime, and confirmed they were already engaged in some of the video capture practice that could be integrated into a video coaching tool. However, the mother mentioned that it was challenging to find the right camera position to capture both themselves and their child, especially on the first attempt. The third finding related to perception of the parent-led video coaching. The therapist and mother agreed that reviewing video would allow reference to be made to previous progress as a source of encouragement, as well as for self-reflection. Also, they emphasized the benefit of having a video focus on specific interactions to establish a visual and concrete discussion rather than relying on verbal communication alone. The fourth finding related to anticipated challenges of the parent-led video coaching. Participants were able to anticipate several potential challenges to overcome for parent-led video coaching, such as that the video coaching would be a way to support home visit, but not a replacement, and the challenge of miscommunication that could be resulted from text-based conversation. In conclusion, our study sought more appropriate solutions that fitted common technology practices while facilitating the required level of support from the therapists. Our design recommendation pointing to that the technology should be pledged to empower and support and enable self-management and full control, as well as being embedded and limiting stress. Thank you for watching, and we invite you to read the paper, which goes into more details about the results and design implications.